Hello, good morning, everyone. Welcome back to day 4 of our webinar series. And today we are going to talk about why is my child not speaking clearly. We still have participants strolling in right now, and I think it's a very popular topic. So we'll wait a little while more. As the past 3 days, I have my colleagues Yvonne, who is joining us today, as well as Jane. Yay! So I still see a lot of my friends from Myanmar. So a shout out to all of you, Mingalaba. And I also see a lot of our parents from Singapore. So welcome. And yes, also some of our ex-colleagues and friends. Yeah, so just a reminder that this webinar will be recorded, and for parents and other of your friends or other colleagues who would like to view the recording, do send them the links which you have signed up. It's the same links, and then we will send them the recording of the webinars, and they can watch it anytime that they want. All right. Another housekeeping matter is that we will be sending out our feedback forms after today. You can give us your feedback about how the webinar went and what other topics you would like to hear from us, and we'll be running more webinar series in the future. Okay, so now we will proceed with our presentation, and I hope you all will have a fun time learning, and I'll see all of you later. Bye.
Hello everyone, and I'm a speech language therapist. Welcome to Summer's Therapy Services webinar series, Talk With Me. So for those of you who have joined us from the previous 3 days, welcome back. And those that have just joined us today, you're in day 4 of our webinar series and our final day as well. So we are conducting this series in line with Summer's Therapy Services 5th year anniversary celebrations. So thank you everyone for joining us. So today we'll be talking about why is my child not speaking clearly. So some parents might comment that, oh, my child is already speaking in short phrases, they're speaking in sentences, or even very long sentences. But I can't understand them, or I don't know what they're trying to tell me. And some of them might also say this, I can understand my child, but no one else seems to be able to understand them. So grandparents might not understand them, or teachers might not understand them. So that's also a very common comment. So today we're going to break it down further and discuss this question of why children might not be speaking clearly, what are the possible reasons for that, and some tips for you to help your child's speech as well. So we'll be going through a brief introduction to speech. So what is speech and how it's formed? Speech developmental milestones, so how does speech develop, the possible causes of speech difficulties, and lastly, some tips for helping your child's speech. So for those of you who have sent in your questions during the registration, thank you so much. For those who still want to ask some questions during the webinar, please feel free to send them in the chat or Q&A box, and we'll be discussing these questions at the end of the webinar. So let's get started. So what is speech? For those of you who have joined us previously, you'll be very familiar with this diagram. So this is just a pyramid which shows how speech and language develop. And you can see that speech is at the very top of the pyramid. So in our previous webinars, we have talked about pre-verbal skills, which are the foundational skills that children have to master before they start talking. And those are the bottom 2 layers of the pyramid. And when children start to master that pre-verbal skill and they start to want to communicate with us, so you can see here, that's pre-verbal skill. And then when they start to communicate with us, we build language here. And when they start building language, there's the understanding bit, and also the use of language, which my colleague Yvonne have covered in webinar 2. And we have also talked about the output, where we use other ways to share our ideas and feelings without having to speak, so without talking, so other non-verbal means. And that's called AAC, the augmentative and alternative communication, which my colleague Yvonne have also shared as well. So today we're going to look at speech, which is the very top of that pyramid. So what is speech? Speech is just a spoken or the oral medium of language. So it's the use of spoken words to express our needs and wants, our ideas, and our thoughts. It's how we say sounds to make up words. And how we're going to say sounds can be affected by 3 different things. So articulation, voice, and fluency. So articulation is just how clear your pronunciation is. So let's say if I want to say the word speech, I need to say 4 sounds clearly in the word speech. Speech, to make up the word speech. And voice, if you put your hand on your throat and feel that vibration there, that is how you turn on your voice. So when it's vibrating, your vocal folds are actually smacking each other here like that, moving and vibrating, and that's how you turn on your voice. And voice, we also look at the pitch, so you can go very high pitch or very low pitch, or you can very loud or very soft. That's the volume. And also the quality of your voice. So if I'm going to talk here for too long, maybe I will have a hoarse voice, or I can sound very nasally, or if I have a nose block, I can sound very hyponasal. So it's just the quality of your voice. And fluency is the rhythm of speech. So when I'm talking, I am not talking like this, so that is not being fluent. So I'm talking fluently like this right now. That's how fluent you're going to talk. So that's fluency. So speech, we'll look at articulation, the pronunciation, voice, and fluency, how fluent your speech is, the rhythm of speech. So speaking clearly takes a lot of brain power and a lot of coordination. So I want to encourage all of you who are listening to think about how you form speech when you're talking. Every single time you want to say something, your brain actually has to think of what words do I need to use and in what order. So if let's say this little boy wants to say something, and he needs to find the words I want to say, and he needs to put that in order. He needs to put I want to say to formulate that sentence. After doing that, then your brain has to think about, what sounds are in each word and in what order will come. So, for example, in the word want, you have 4 sounds. W, a, n, t. And how are you going to organize these sounds in order? That is that part where you have to go, the w sound comes first, and then a, n, t, to make up the word want. So you have to organize the sounds in order. After doing that, after assembling the sounds in the right order, then your brain has to tell the different muscles from the different speech subsystems to move and where to go to for every single sound. So it's so complex. There's so many things going on there. So after assembling that sound, then you need to think about which muscles I need to move and in what order. So there's a lot of muscles that are involved in speech and different subsystems that are involved when we are producing speech, when we are talking. So when we look at this diagram, let me talk through how speech is formed. Okay, so first you need your breath support. So respiration, your breath support, and the coordination of your breathing. When you're talking, we inhale air and then we exhale air as we speak. Inhale and talk at the same time. It's going to be so tough. So when you're doing that, it involves your lungs and also your abdominal muscles to push the air up. And when it goes up, it goes to your vocal folds in your larynx area, also known as your voice box. And as I mentioned before, you see, it will vibrate as you turn on your voice. And when it goes further up, some sounds goes through your nose. So the sounds, the sounds, the sounds, they are all through your nose. And some sounds will be going through your mouth, and it's shaped into different sounds with different parts of your mouth. So let's look closer at this area here. Let's look closer at the mouth area. Okay. So when we look at the mouth area here, you can see that different sounds are produced when different parts of your mouth move in different direction. So look at so many sounds that p, b, w, v, th, t, d, s, z, ch, j, sh, j, y, k, g, h. And when you're doing that, your jaw, your lip, your tongue, your teeth, your palate, so the palate is the roof of your mouth, all of them are involved to produce speech. So for example, if I want to say the first sound there, my jaw has to move up to close that lip, and my lip have to puff that air out. So my lip has to work as well, my lip muscles. And my tongue is not really doing much of things. But if, let's say I'm looking at the sound as in la. So if I'm doing that, I have to move my jaw in a certain height. My lips are not closing. My tongue is elevating up to the roof of my mouth to make the sound, lion, So as you can see, there's your jaw, your lip, your tongue, your teeth, your palate, the roof of your mouth. All of them are involved to produce speech, and we might take this for granted, we might take speech for granted, but it's a very complex process. There's lots of processes involved in it, and lots of different muscles as well. So now that we have gone through what is speech and how it's formed, now let's look at how speech develops. So speech development begins before children say their first words. So at birth, children might cry, they burp, they cough, they have hiccups, so all the natural and reflexive kind of sounds. And at 2 to 4 months, they start to coo, and coo goes like, so it's very vowel-like kind of sounds. And 6 to 8 months, they start to babble. And babble, I always like to tell parents, it's sort of like the children experimenting the different sounds that they can make using the different parts of their mouth. So babble, there's the canonical babbling and the variegated babbling. So 6 to 8 months, they might have a few sounds there and they go and 8 to 9 months, they start to have more sounds, more consonants, more different a variety of consonants and vowel sounds. So they go and there's a lot of different sounds that you can hear there. And 9 to 10 months, children use jargon. So it's still a string of sounds with different sounds there. It's longer than babbling. And there's also tone involved in that. There's different intonation when they're talking to you. So it seems like they're having a conversation with you. So they can go and you think that that's a question, and you go, and that's like a statement. So it seems like they're having a conversation with you, but actually there's no real words in it, and they're all gibberish there. And at around 12 months, that's when children start to have their first words coming out. And just because they have their first words doesn't mean that all the sounds are there yet. So let me talk through with you about this chart. So as you can see, as children grow older, they develop different sounds. So it doesn't mean that when they're at this stage at 12 months, when they're saying their first words, they're already having all the sounds. Not yet. Children have to develop, also structurally, they have to develop the different muscles of the mouth, the jaw, the lip, the tongue, before they develop different sounds in their system. So this chart shows a rough guide of when certain sounds start developing. If you can see, the very top of the table there is the age. So just to take note, each child develops differently, and this chart is just a general guideline of the milestones of when most of the population within that certain age start having these sounds. So if you're looking at the chart, let me show you here. If you're looking at the chart, for the bar on the left side here, the end here, it's where 50% of children start producing the sounds, so p, h, w, and b correctly. And at the end of the bar here is where 90% of children can master these sounds correctly and consistently as well. So this chart is not meant for diagnosis, and if you are concerned about your child's speech, do seek professional advice for a thorough assessment so you can get an accurate diagnosis, and then that will inform your treatment plan. So as you can see from this chart, there's different groups of sounds that are mastered first. So like the p, h, w, b. Children start to develop these sounds before 2 years old, and they are clearer and they can master this sound consistently by around 3 years old. Then we have the k, g, n, t, d, sounds, and then f and y. And when we move on to the older age group, you have the more complex sounds like or or j or zh. So those are more complex sounds that involve more movement, more movement of the jaw, the lip, the tongue. The tongue have to go to a certain place to make that sound. So more complex sounds there. And essentially, by 3 years old, you should be able to understand your child's speech around 75 to 100% of the time. And by 4 years old, familiar listeners, so parents or caregivers, should be able to understand your child all the time, so 100%. And most unfamiliar listeners can also understand your child's speech by 4 years old. So 2 things to take note when we are looking at this chart. So as you can see, as I mentioned before, the left and the right of that bar, you can see that there's a wide range to it. So for example, the first sound there, as in red. Children can start developing the sound as early as 3 years or as late as 8 years old to master that sound. So there's a range there, and it really depends on the child. It's every child develops differently, so there's a range there for them to master that sound. And as you can see from the chart also, there's certain groups of sounds that come first, and that relates to which part of our mouth the sound is produced. So for example, the first group here, the p, b, h, w, will come out first, and then you see the next group, and then the next group, and then the next page you can see another group there. So it's all grouping together. So it relates to the different parts of the mouth, and as I mentioned before, structurally, the sounds are also correlated to how the children grow in terms of structurally their jaw, their lip, their tongue, their cheeks muscle, their teeth. So that is also correlated. So the structure part correlates with when they start developing the sounds. So structurally, your jaw will start developing first, and then your lips, and then finally your tongue. So the tongue has the finest movement there. So for example, if I want to say the earlier sounds like for mama, I'm actually just moving my jaw. So if you put your hand below your jaw, you can feel that your jaw is moving up and down. Mama, mama. And if I'm going to say my jaw is moving up, and my lips is just closing because my jaw is moving up there. I don't really need to use much of my lip muscles and my tongue muscles. It's more of my jaw and my lips closing too. So a little bit of my lip muscle there, but not too much. But if I'm doing the sound p, b, as in papa or ball, you can see that my jaw is moving up. Now the difference between the sound is that my lips have to work harder to pump up the air for p, papa, and b for baba, ball. So for the b sound also, I am turning my voice. So you can hear no vibration here. B, I'm turning my voice on. And as children develop the muscles, then you go through your tongue movements. So like t, you have your tongue touching behind the top teeth, t, and you have k, g, and then where it's more complex, where you need to elevate your tongue for or roll your tongue back for So there's different structures also that's involved in the development of the speech sounds. So as I mentioned before, that how the sounds correlates with the different structure. If children have lots of sounds to work on, so for example, if the child is already at around 7 years and there's so many sounds that they haven't had yet, they don't really have the earlier sounds like p or b or k. But look at the chart here where 7 years old, you're already having so many like j for jam or v for van. When we're looking at the child's speech sounds, we're going to take an inventory of it, and we're going to work on the earlier sounds first. If there's lots of sounds that they have to work on, we're going to work on the earliest. Despite their age, we're going to look at the earlier group of sounds first, so the p, b, w sounds, before we work on the more complex sounds like oo and So now we have talked about how speech develop and how different sounds emerge as children grows. Now we're going to delve into what are speech sounds disorders. So if you're here today listening to this webinar, you're probably concerned about your child's speech. So we're going to talk about this topic a little bit more about what are speech sounds disorders. So speech sounds disorders are speech disorder in which some speech sounds in a child's language are either not produced correctly, or not used correctly. So as children learn to make new sounds, please take note that it's very common for them to make mistakes. So they might leave out certain sounds, they might not produce certain sounds. Like for example, they might say nana for banana, or cat for cat. So they leave out the t sound at the end. It's very common for them to make those mistakes. Or certain sounds might not be produced correctly, Or they might substitute certain sounds with another sound, so it's not used correctly. So they might say tat for cat or rabbit for rabbit. So that's very common. They're trying to figure out that speech sound, where to place their muscles. It's like something like we want to drive and we go for a test drive first, and that's when we make a lot of mistakes, and then we get our driving license and then we can start driving. So it's more of like trying to figure out that sound system and also to move the different muscles to produce that sound. However, if the mistakes continue to pass certain age, or the errors that they're making are uncommon, then it can be considered as a speech sound disorder. So speech sound disorders, this term of speech sound disorders is just an umbrella heading under which there are several subcategories. And coming back to our question of why is my child not speaking clearly, there are different underlying causes, different subcategories, and the severity of it also within the categories might be different as well. And the different categories can also overlap and happen together as well. So children who have difficulties planning their movement, the different parts of the muscles, they might also have muscle weakness that can overlap as well. It depends on the child. That's why we need thorough assessment to figure out and to get an accurate diagnosis to inform our intervention approach. So let's look at the first one, sensory and perceptual. So first thing to rule out is whether or not the child has hearing difficulties. If children can't hear or process sounds or they can't hear the sounds clearly and accurately, then they can't produce the sounds accurately. So that's one thing that we want to rule out. So if you're concerned about your child's speech and you haven't done a hearing check yet, please do consult an audiologist to get a hearing check to get that part ruled out before we move on to more thorough assessment for speech. Okay, another cause of speech sound disorder is phonology. So phonology, this is a very technical term. Phone just means sound and logy means study, so the study of sounds. So it's our speech sound system, how we categorize and sort sounds in our head. So let's go back to this diagram. When we figure out what words to use and to form them into a sentence, now we need to figure out what sounds to use and in which order to formulate that each word, to produce each word. So it's our sound system. I need to figure out there's the w sound, 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 and t sound in the word want. And I need to assemble them in the right order. That's the phonology part. And as children learn to talk, it's common for them to use patterns of sound errors to simplify speech. So they do this because they don't have the ability to coordinate their jaw, their lip, their tongue, their teeth, their palate for clear speech yet. So as a result, they simplify complex words in predictable ways until they develop the coordination required to say the sounds clearly. So for example, they might say tat for cat. So the t sound, for the k sound, cat, they substitute for the t sound, tat. And they might say wawa for water or sorry for sorry. So that's very common for them to make those mistakes, those errors of those patterns of sound errors while learning their sounds. But as children mature, they stop using these patterns to simplify words. So if they continue to do so, or they make uncommon sound error patterns, that's when they should get it checked out for more thorough assessment. So now we talk about the phonology part, the hearing part. Now, after organizing the sounds comes the planning bit. So children who have difficulty in this area, we call the technical term apraxia. So after assembling, you need to figure out which muscles need to move and which order. So that's the motor planning bit there. So for example, if I want to say for mama again, I have to use my abdominal muscles, breathe have that breathing coordination. Inhale and exhale, and exhale, I push my abdominal muscle, push the air up. I'm going to turn on my voice for the sound. I'm going to move my jaw up, close my lips, and the air will go through my nose to go for that sound. So there's a lot of muscles that are involved to make that single sound. So that's photo planning. So apart from hearing, sorting out the speech sounds in our head, and the planning bit of where to move our muscles, next we're going to execute the plan. So the last step, this is the last step where you already have the recipe, you're already following the instructions to bake the cake, and now you want to put the cake in the oven. So that's executing the plan. We want to have that last step of saying that sound. So difficulties in this area of executing the sounds can be impacted by different causes. So it can be functional, it can be motor or neurological, or it can be structural. So for example, if a child, for the structural bit, if a child have cleft palate, or any other orofacial anomaly. So if let's say they have cleft palate, so some of their sounds might go through their nose instead of their mouth. Or if they have a lip tie on the top, they might not be able to close their lips for the sound, the p sound, the b sounds. If they have a tongue tie, they might not be able to elevate their tongue for the sound or the d sound if the tongue, if they have the tongue tie. Or if they have damage to their vocal folds, then they might not have a voice. So any structural deficits, either developmental or acquired. So acquired can be through trauma or surgery that affects that certain structure of for us to produce speech. So that's the structural bit. Now let's look at the execution bit and the articulation bit. So the execution bit, dysarthria, it's when so dysarthria is a technical term for muscle weakness. So you know where to place your jaw, your lip, your tongue. You're trying to move to the right place, but it's affected by muscle weakness. So for example, I want to put the cake in the oven. If I have a structural deficit, I might fracture my arm, then I can't carry that cake tin into the oven. Now, I don't have any, for dysarthria, I don't have any structural deficit, but my muscle is weak. So if I'm not strong enough to carry that cake tin into that oven, then I'm going to drop that tin as well. So it's about knowing, so dysarthria, you're knowing the placement of where your muscle should move to. You're trying to get to the right place, but it's affected by muscle weakness. And for articulation, you have no problems with the muscle structure or the function, but you have difficulty moving that structure to the right place. So for example, with the scenario of that baking that cake and putting it in the oven. So now I have no structural deficit, my arm is fine, I'm strong enough to put the cake tin into the oven, but I put it in the wrong compartment. So I'm supposed to put it in the middle rack, but I put it underneath or too low, and it cannot be baked, or too high and it's overburned. So that's the articulation bit. There's no problem with the structure or the function. It's just difficulty moving to the right place. So speech-wise, for example, the most common example is having a lisp. So for the tongue, if I want to say speech, I might say teach, and I teach rather than speech. So my tongue is actually going over and going in between my teeth rather than behind my teeth. So it's a difficulty to move to the accurate place for that particular sound. So we have gone through all of this about speech sounds disorder, and coming back to the question of why my child is not speaking clearly. There's different causes, different subcategories, and within those categories, there's different severity, and the categories can also overlap with each other. So which therapy technique should we use? If there's so many different speech sounds disorder, different categories, which one should we use? Well, there's no one size fits all. So therapy is unique for your child. There's varying approaches, and it's depending on your child's presentation, the severity, the underlying causes, their cognitive and language skills, and also their ability to attend, their temperament, their resilience. So some kids, they can sit there and do speech drills, but for some other kids, they might not be able to sit there and do speech drills with us. So it really depends on the child, and it's unique to the child. So to find out which approach to use, if you have any concerns regarding your child's speech, find your nearest speech language therapist to get a thorough assessment, to get an accurate diagnosis, and then your speech therapist can match your child to an intervention approach that best suits their needs. And our goal is always to help the child to say the speech sounds easily, independently, and consistently. So if you're here today and you're concerned about your child's speech and you're thinking, oh, what can I do? Here are just some quick suggestions, tips that you can start using today. This is just a very basic kind of suggestions. And as I mentioned before, some children with the more severe speech sounds disorders, they might need to have intensive intervention. So this is just some basic things that you can do at home with your child. So tips for speech: show, slow, and stress. So the 3S. And with every other skill, model, model, model. So let's look at the first S, show. So show can be in two ways. So you show your child and your child shows you. So when you show your child, it's about showing your child as you model the sounds in the words. So get down to your child's level so that they can see your mouth and they can see your models visually, and then it can reinforce for them to properly say certain sounds. And your child to show you is when, for example, if you don't understand your child, it will be frustrating for them, and also frustrating for you to see your child in distress as well if you can't understand them. So what you can do is to ask your child to show you what he or she wants. Then you can interpret that message when they show you and model for them to say that sound or that word clearly. So the second S is to go slow. So slow down so that your child is encouraged to speak at the same rate. When you slow down, they have more time to coordinate the different muscles for speech. And the third one, stress. Instead of asking your child to repeat the word correctly, model the word by emphasizing the sound in error correctly. So for example, if your child says, I want the big car, so don't ask them to repeat the word car. You can straight away model and stress that sound. Oh, you want the big car? So you're stressing that k sound and go, you want the big car? Instead of asking them to say car. So don't ask them to repeat the word correctly, but model for them. Model by stressing the sounds. So putting these three strategies together in an interaction, when your child, for example, if your child says, that's a punny one. So one thing you can do, show them. So be at their level. So you look at the mom being at the child's level so that the child can see her mouth shape. and you go, yes, that's a funny one, a very funny, funny one. So you're actually showing them that the teeth and the lips go behind, the lower lip go behind the teeth and go the funny one. You're showing them the structure for that speech sound, your mouth shape to produce that speech clearly. You want to slow down your speech rate and stress the error sounds correctly and repeating it multiple times in an interaction. So yes, that's a funny one. A very funny, funny one. So you see how I repeat 3 times there? There's multiple times for them to look at your mouth shape and for them to listen to that sound. So takeaway points for today. We have gone through what is speech, and we know that speech is a very complex process, and there's a lot of processes involved to form speech and produce speech, and different muscles that are involved. And there are different underlying causes and subcategories of speech sound disorder. So it's very important to get a thorough assessment, to get an accurate diagnosis to inform treatment. And there's no one size fits all for therapy approaches and techniques. So therapy is unique for each child. And we also talk about the tips for improving your child's speech clarity. So the 3S: to show, to slow down, and to stress, and to model. So, and also it's very important to seek professional advice for thorough assessment to find therapy that best suits your child. With these strategies, it's just a very basic strategy, and you still want to go for a thorough assessment to figure out which strategy, which additional strategy you can use to help your child's speech. Okay, so that's it for today. Thank you everyone for joining us. Now we are going to discuss some of the questions that you sent in.
Right, thank you, Jane, for the amazing presentation. We have a good understanding of the processes of speech and the different causes, as well as some tips that we can use. So do remember to send in your questions. We'll go through the few that we have now. So I would like to invite Jane and Hui Ting to join us to answer these questions, okay? So we have our first question here. It's from a participant, and she says, my child is 13 years old and non-verbal. Will she ever have speech? Would Jane or Hui Ting like to answer?
Yeah, I'll start answering that question. So 13 years old and don't have speech yet. So the answer would be yes, there's a possibility for speech. It's just that we have to set the expectation of what she'll be working on to say. And also from my own personal experience, I have clients who's already 20 years old, and after we did some oral motor work, then to build up that system and the different muscles that we are talking about just now, the different muscles for speech, then she started to have some sounds, and then we combine those sounds together to make up some words that she can use to say. And even then, she already has a system. So the system that she's using is PACS, and she actually used that AAC system with her. And through that, we also do some speech pairing with the AAC system, where she might say, I want water, and then we do that speech pairing together with the AAC system. And with the AAC system, as my colleague mentioned yesterday, so Yvonne have shared that with the AAC system, it also helps to build not only communicating that basic needs and want. At the end of the day, we want to look at that overall communication of them sending that message out across to us. So that's the main goal for them, so that also prevent that frustration of people not understanding them. So we look at the whole thing, the communication part, but also not neglecting speech and doing that speech pairing together. And that oral motor work is to build that system up and the muscles to get ready for speech. So yes, there's a possibility there.
I would also like to add that I think a lot of parents, when they Google and they see that internet will say that the window, the closing time for a child to acquire verbal speech is at about 7 or 8 years old. Yes, that's not untrue, but personally, we also have a lot of kids who are like 10, 11, 13, even 20, like Jane shared, that they have acquired speech. We're not talking about 100% clear speech. We're looking more at about 80, 90%, where the parents and close family members understand what they are saying. Yep. So that's the target that we work towards.
Okay, thank you for the sharing. I hope that answers your question. We are going on to our next question. So my child is now 12 months. He duplicates syllables ka, ka, pa, pa. How can I improve his speech?
Okay, thank you for the question. So it's good that your child has now developed some sounds there. What I want to look at also is what other sounds that he can say, and also what is he using those sounds in what situation, like kaka, papa. We want to look at, so we talk about that pyramid of how we need to build language before speech. So let me just pull it up so that everyone can see this. All right. So, so as we talk about the language pyramid, here, and we talk about how there's the pre-verbal part at the bottom of the pyramid, and then the language comes in. So here, yeah. So the language part and then speech. So first, we also want to look at what language skills he has. Is the foundation enough? Does he have enough words? And then we want to build on speech. And then for speech also, we want to look at how we talk about the different processes. So you want to look at what sound system, that muscle that he uses to pronounce those sounds. So is it a structural thing? Is it, so we can see the different underlying causes there. Is he saying papa, the per sound, the k sound? How about the other sounds? So per sound, you have other lip sounds like b sounds, sounds. K sounds at the end, you have the g sound. So like different sounds. What sounds does he have? What sounds he still requires help with? And then we can go on from there. So you really need to see that the assessment bit, which underlying causes, is it a motor planning thing? Is it a sound thing? Is it articulation? Is it a combination of different things? Then we can figure out how best to help to improve that speech. Yeah?
Thank you.
I also like to add that sometimes we will see what sounds the child have, and then we shape it into words. Yeah, so like if the child can say papa, then when we show the child apple, we might want to get the child to try to say appa. So we try to shape it into words and guide the child towards first words. Yep.
Alright, so now we'll move to the next question. My child has difficulty with S and has been going to therapy for a while. What can I do?
So it's good that you pick up that, and also you've been to therapy to seek professional advice. That's a good start. Again, we want to see what is going on in their sound system. So we really need to, the first thing to look at is what are the underlying causes that makes her have the difficulty to pronounce that S sound. So is it a structural thing? Is it motor neurological? Is it
Is it because she has difficulty hearing that sound, so she can't produce that sound? So we talk about that umbrella there, where there's different causes to it. And also we want to look at, because she's already in therapy, right? So we want to see has she been doing in therapy, what works and what didn't work. And then we can go on from there to figure out which approach suits her best to help improve that speech sound. Yeah.
Thank you, Jane. Agree that we do need to look at the underlying causes and figure out from there and have a review of what has been working and what she has been doing so far. So we have another question here. My child speaks too fast. What tips can I use to slow his speech? Would either Jane or Hui Ting like to answer?
So it really depends on the child, again, what works for him or her. For some of the kids that I worked with previously, we have done this to slow, different techniques that we use and figure out, it's like a trial and error process to figure out what suits the child the best. It might work for one child, it might not work for another child. So I have two different cases where in some instances I use visuals. So visuals like cheetah goes very fast and then the turtle go very slow. And then we have the different rates to show them. Or some kids, they use a metronome also. They know the beat. Okay, go slower, yes. And sometimes we work through songs as well. So songs have different rhythms as well. Those are some of the strategies that we use. We use clapping also to have that slower beat. So umbrella. Yeah, so we use the different strategies there. So maybe Hui Ting can share also some of the strategies that you might use with some other children.
I think a lot of my kids that I encounter, they have poor breath support. That's the reason why they are speaking very fast. So they not have enough air to last them through the entire sentence. When we speak a sentence, a short phrase, it takes about 3 to 4 seconds. So you must have enough breath and you must grade it enough. So that means you must control it enough, slowly enough, so that all your words will fill in that one breath of air. So if your breath support is really poor and it can only last you for 1 to 2 seconds, and you have 4 to 5 words to squeeze in to that 1 to 2 seconds, you have to speak really, really fast. All right, and that's where we will realize that, oh, maybe I need to work on the system, the child's breathing system, breath support system, to help him get longer breath, have better control, so that he has the ability to control and sing and say the words, all the syllables in a longer time. Okay, so like Jane was sharing, singing is one thing that's really good. So for us, usually we will start with blowing exercises to work on the breath support, and then we go on to using the kazoo. The kazoo is an instrument where you have to voice in it. You have to say ooh. That's when you combine two systems together, the breath support and the voice. And then after that, we will work on them humming a tune using the kazoo. So they don't have to worry about moving their mouth or tongue or lips to produce the lyrics. They just have to use their breath support and the voice to hum a song like ooh, 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 ooh. So that's where they learn the rhythm and extending their breath for a longer breath. Yeah, and then later we can work on adding the lyrics and how the mouth, the jaw, the lips, the tongue should move. Yep, so that's how I would work on slowing the child down in his fast speech rate. Yep, hope that helps.
Thank you. So we have many strategies. We can try visuals, we can use blowing, working on the support system. So I hope that's helpful for you. We have another question here. Sometimes my child is clear, but sometimes he is not. What can I do?
Yeah. So sometimes he's clear, sometimes he's not. So congrats on the time where he's clear. And those that are not, don't worry, we'll be working on, as I mentioned before, the goals we are working on not only towards the child being clear, but also for them to say it consistently in different scenarios with different people, in different, for example, so when we need to figure out when is he clear. So is it when he's saying certain sounds? Is he when he's saying single words instead of long sentences? Is it he's not as clear when he's excited, so he's talking very fast and then it's not as clear? When he slow down his rate, is it clearer? Does it help? Or is it something like, let's say, he's talking to a familiar person, so it's clearer to that person compared to an unfamiliar listener who doesn't know what he's talking about. Is there contextual cues around you that can help you understand what he's trying to say? So he might point to something like a ball, then he said a long sentence about the ball, but you know he's talking about the ball, then you can make sense of it. And that's how you use that tip of modeling that and stressing that sound ball for him. Oh yeah, that's a big ball, for him to listen to that language and that speech sounds in that word or that phrase. So it really, there's so many elements to it. You really need to figure out where he's at and then go on from there to help him to produce those sounds more consistently so that he's clear in different scenarios with different people.
Thank you, Jane. So yes, indeed, we must be clear of what context and where the child is clear so that we can tailor a program that will suit the child. We are running short of time already, so perhaps we'll answer our last question and then we will end our webinar today. So our last question is from a parent. I think she has joined us for the previous webinars as well. So you say, we have learned so many tips and so much that parents can do to help with speech development, but how can one possibly put these tips into effect 24/7? Do you have a further tip on how to cope with this overload for parents? Will Hui Ting or Jane like to answer?
Yeah, first of all, hi, thanks for joining us for the 4 days. I think 3 of us know these parents, so hi. And thank you for that question. I think, you know, sometimes as professional, we go blah, 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 all the knowledge, all everything, and there's different, some of the parents, they work with different therapists. There's so many info going on there. From the first webinar to the 4th webinar, so many different strategies. Where do I start? I still have other things to do, my laundry, everything, wash dishes, change nappies, so many things that I have to do. Yes, it's true. So that's why, as I mentioned to some parents also, it's really a collaborative process. You need to figure out what suits your child, but also you the best. Yeah, and where to start, as we mentioned, from the pre-verbal skills, from language, AAC, speech. There's one that is very common, which is to model, really model for your child the different skills that you want them to learn. So you can start from there, see what they're interested in, and then go from there. Yeah. So so this is really a collaborative process, and you just see what works for you the best. Really discuss with your therapist and see what you can do at home with your child. Yeah. Anything that Hui Ting would like to share?
Yeah, I think it's a very common thing that parents are telling us that they are overwhelmed. First, when they get a diagnosis for their child, that the child is delayed, has a lot of different needs, they want to solve the problem immediately. But many times we have to remind ourselves that it's better to be slow than to be fast. And many times slow is fast. You know, if you follow the child's pace and you go slowly, he will learn better than you dumping everything on him. He stresses out. The brain has too many stress hormones. There's no way the child can learn. All right, so imagine you're being chased by a tiger. Do you think you can learn anything while trying to save your own life? So it's really tough for you and for your child as well. Okay, so research has shown that every day, if you give your child undivided attention for just 20 minutes, okay, 20 minutes is going to be really, really helpful. So from now, you might want to just choose one strategy, spend 20 minutes of undivided time, and then see what you get from the child. Okay, so for example, you say, okay, today I'm going to work on modeling language about object names. Okay, so you're going to choose one object, and during playtime, you say, I'm going to want ball. Okay, so 20 minutes you play with the ball. You can work on single words ball. You can work on the verbs throw. So while you model the action, you model the word. And you do that 20 minutes a day for a week. And you see the child's vocabulary for ball will be there, will increase. Okay, so choose one thing at a time, and then one activity, one object. Okay, always start with the basic, and then you slowly build up. So don't rush yourself, don't rush your child. All right. And then anytime you have any questions, feel free to email us. We'll be more than happy to answer them. Yeah.
Yes, thank you for the insightful tip on how to manage all our tips that we have given out as well. So basic premise, one step at a time, take it one day at a time. So I think now I'll pass back the time to Hui Ting. We have overrun by about 4 minutes. Thank you for staying with us. There is a special announcement, so you'll be glad that you stayed. So Hui Ting, please.
Yes, the announcement is our summaries app is still free till this Sunday. All right. So that's the app summaries, the one with the yellow icon. So yes, got all summaries of the research articles that we've gathered. It's actually created by ourselves because we feel the parents who are and professionals who are searching for information in whatever that's out there and it's not research based, it's not evidence based. Yeah, so do take a look, do download it. It's for iPad and iPhone only at the moment, and we are working on Android. Yeah, and a reminder that we'll be sending out our feedback forms to you. There's an option for you to tell us what other topics you would like to hear us on our webinars, and also to let us know whether you'd like to be on our mailing list so that we can update you of our future events and even strategies and tips that we might have. So if there's no more questions, I will see you all next time in our webinar series. Hope you all have fun. Bye.